Hello, beautiful acupuncturists. We're going to do a quick lesson today on a concept. It's an NLP, Neuro Linguistics Programming concept called Rapport. So real quick, NLP, I think I've talked about it in the videos before. If not, or if you're new with me, hi, I'm Dr. Charlene Lawrence, and we'll just quickly talk about what NLP is. It is neuro linguistics programming, and it is exactly how the words break down. So reprogramming the mind, so reprogramming the neuro part of the brain using linguistics, language. And so really it's just talking and communicating in either verbal or nonverbal ways to help reprogram not only our minds, but the minds of our patients, and using that for success. Now, not all hypnotherapists or hypnopuncturists utilize NLP. And for some reason, I just don't understand why. I think it is such a powerful language tool to form everything in the positive, to transform just small, minor words that we use to allow for bigger and better growth. So I always incorporate NLP into my treatments, especially my hypnopuncture treatments with my patients. And today I want to talk really quickly about rapport. Before I learned NLP, and perhaps you were a little bit like me, I thought rapport was just having kind of a good connection with somebody. And that might happen instantaneously, or it might happen over time. And the really exciting thing is that we can actually use certain techniques to gain rapport more quickly. So I'll tell you how I use this in the treatment room and even outside the treatment room. So we're going to talk about matching and mirroring today. When I think of mirroring from an acupuncture standpoint, I'm thinking, okay, the shoulder to the hip or the elbow to the knee, and maybe we're going to, mirror the whole body on the foot, like reflexology, and just kind of where I might place the needles. Well, we can match and mirror people also to allow their unconscious mind to buy into what we have to share with them. And so if I'm going to use this in the treatment room with a patient, especially if it's a new patient and I've never met them before, I really want to match or mirror what I'm doing with them. So mirroring is simply just matching my body language with what they're doing. So if the patient is sitting in the chair across from me, and they cross their legs, I'm doing it right now. You can't see, but I'm doing it anyway. Then I am going to cross my legs too, most specifically in a mirrored fashion. So I'm sitting across from them. They cross their left leg over their right. I'm going to cross my right leg over the left. And then that way our bodies are actually kind of pointing in the same direction. This is going to unconsciously allow their mind to trust me a little bit more. And then same thing if they're, tapping their finger or bouncing their foot, I might do something like that. Obviously, we don't want to be super obvious about it. We want to be very subtle in the ways that we do this so they don't get offended consciously. And at the same time, their unconscious is going to see this and be like, oh, this person is like me. I should trust them. So mirroring is a great technique to build rapport with our patients. And another thing you can do is called matching. Now, there are so many techniques that you can use with matching, and I'll give you just a couple. So a moment ago, I mentioned bouncing my foot up and down if they were doing the same. Perhaps they're a little nervous, so I might bounce my foot up and down and they'll think, oh, maybe she's nervous too because she's, meeting me for the first time or whatever. Unconsciously, again, that's going to say to the unconscious mind, oh, this person is like me, therefore I can trust them. Now, if I wanted to use a matching technique and they were bouncing their foot up and down, I might take my pen and I might kind of gently, subtly tap it at the same rhythm. So that is a matching technique. I'm doing a similar motion to what they're doing with their foot at the same or similar rhythm. And again, unconsciously, the mind is going to think, this person is like me, they're matching me in some way, therefore I can trust them. Another great thing to do is allow yourself to match your breathing with the patient's breathing. So if they're breathing a little more shallowly, you can go into that. And once you are able to align your breath rhythm with the way that they're breathing, then you can actually guide them. So once their unconscious mind notices that you guys are breathing in sync, then you can start to slow and deepen your breath, which will allow them to slow and deepen their breath. And the last thing that I want to bring up, which can be really helpful as well, is going to be to match and mimic their tone and their volume. So when they're speaking, if they're a very loud speaker, you can start to speak a little louder. These aren't my favorite because you can hear everything through the walls in my clinic, so I want my patients to be a little quieter. But I have those patients who are a little bit vociferous. They have very strong lung qi. And so you can match your tone to their tone if they're excited, if they're an excited talker, if they're really like calm and reserved. You can match all of those things. And again, the unconscious mind is going to build rapport more quickly. It's going to start to think, oh, this person is in alignment with how I operate, therefore I can trust them. And we all know the deeper trust we have with our patients, the deeper the healing is going to be. Now, you can utilize these techniques outside of your clinic as well. If you're out networking and meeting other professionals, or possibly working with people who are wanting to work with you and meeting them outside, or at a speaking engagement, when you have the opportunity to speak to those people individually, you can match and mirror their behavior. And that way, again, you're just going to build rapport more easily. Thank you so much for listening to me today. I hope this video was helpful, and I would love for you to reach out and let me know just how well your matching and mirroring are going, and if you have any issues that arise. And so go ahead and drop a comment in the comment box and ask your questions, and I will check in with you next time.